Did you have a stroke and want to know how to regain movement in your hand? One of the common aftereffects of a stroke is losing movement in one of your arms. This occurs because a stroke can cause damage to the brain, specifically in the areas responsible for motor control, resulting in muscle weakness or paralysis. Many people then wonder if it is possible to regain hand movement after a stroke. The truth is, yes, it is possible to recover hand movement with appropriate and consistent rehabilitation. The brain's neuroplasticity allows for reorganization and the formation of new neural connections, which can lead to the recovery of motor functions. In this video, I'll show you 3 essential tips to properly stimulate your hand, increasing your chances of a good recovery. So, it's very important that you watch the entire video without skipping ahead. And pay attention, because the second and last tips are the best. That said, subscribe to the channel and let's get started. Number 3. Avoid stretching your fingers upward. Many people, in an attempt to improve hand movement after a stroke, end up pulling their fingers upward or forcing their hand against their thigh to try to open it. Although these practices may seem helpful initially, they can cause significant damage to the natural structure of the hand. The human hand is formed by several natural arches, both longitudinal and transverse, that are fundamental for performing daily tasks such as gripping, squeezing, and manipulating objects. These arches allow the hand to adapt to the shape of objects, providing a firm and efficient grip. When you force your fingers upward or press your hand against your thigh, these arches can be flattened or distorted, which can seriously compromise hand functionality. Additionally, forcibly stretching your fingers can increase tension in the tendons and ligaments, leading to pain and inflammation. This practice can also aggravate spasticity, a common condition after a stroke where muscles become excessively tight and contracted. Spasticity can cause the hand to close involuntarily, and forcing it open can cause microtraumas in the tissues, further delaying recovery. Therefore, to promote effective recovery and preserve hand functionality, avoid forcibly stretching your fingers. Instead, opt for massage techniques and exercises that respect the natural arches of the hand and provide appropriate stimulation without causing damage. This includes gentle movements that encourage flexibility and strength in a controlled and gradual manner. Of course, always emphasize the importance of consulting a specialized physical therapist for personalized and safe guidance. They can provide exercises tailored to your specific needs, ensuring that you are on the right path to recovering hand function healthily and effectively. An extra tip I'll give you here is that if you want to know a way to definitely support your cardiovascular health with proven procedures that help clear your arteries, reducing the risk of stroke and heart attack, I have left exclusive content as a thank you to you who are following my channel. Access it now by clicking the link in the first pinned comment of this video and find out how you can clear your arteries using a simple and proven method. Continuing. Number 2. Seek a specialist neurophysiotherapist. A neurophysiotherapist has specific knowledge about neurological conditions and is equipped to develop a personalized treatment plan that meets your individual needs. Additionally, a neurorehabilitation specialist understands the complexities of the nervous system and the specifics of post-stroke recovery. They are trained to identify areas that need more attention and apply advanced techniques to promote functional recovery. They can guide you with accurate assessment. They will conduct a detailed evaluation of your condition, considering both physical and neurological aspects. They can identify specific problems such as spasticity, muscle weakness, or coordination and balance deficits. Personalized treatment plan. Based on the assessment, the physiotherapist will develop an individualized treatment plan focused on your specific needs and goals. This plan may include exercises to improve strength, mobility, and coordination, as well as techniques to reduce spasticity and enhance motor function. Advanced rehabilitation techniques. Neurofunctional physiotherapists use a variety of advanced techniques, such as constraint-induced movement therapy, functional electrical stimulation, and gait training in virtual environments. These innovative approaches can accelerate your recovery and help restore functionality more efficiently. In addition to conducting physical therapy sessions, the specialist can provide ongoing education about your condition and guidance on how to manage symptoms at home. They can teach exercises you can practice between sessions and offer tips for incorporating rehabilitation into your daily activities. And of course, the neurofunctional physiotherapist will monitor your progress over time, adjusting the treatment plan as necessary to ensure you are making continuous improvements. This includes regular reviews to assess your response to treatment and make modifications that maximize results. Moreover, having the support of a dedicated professional who understands your difficulties can be extremely motivating. The physiotherapist will not only provide technical guidance but also encouragement and emotional support to help keep your motivation high throughout the recovery process. Seeking a neuro-rehabilitation specialist is an essential step to maximize your recovery after a stroke. This professional will not only help restore physical functionality but also contribute to your independence and quality of life. Remember, every effort in your rehabilitation is an important step towards regaining your autonomy and well-being. Number 1. Include the affected hand in daily activities. The best tip for last. Incorporating the affected hand into your daily activities is essential for promoting a faster and more effective functional recovery. After a stroke, it is common for the affected hand to be used less due to weakness or difficulty with motor control. However, avoiding the use of this hand can result in additional loss of function and hinder recovery. To stimulate recovery, it is crucial to involve the affected hand in various everyday tasks. This provides continuous stimuli to the brain, encouraging neuroplasticity, the brain's ability to reorganize and form new neural connections. Here are some practical ways to integrate the affected hand into your daily activities. Cooking and food preparation. Use the affected hand to hold ingredients while cutting with the other hand, mix salads, or hold pots and utensils. These simple movements can help strengthen the hand and improve coordination. Personal hygiene. During bathing, use the affected hand to hold the sponge or toothbrush. This not only helps with physical recovery but also maintains independence in daily activities. Dressing. Try using the affected hand to pull zippers, button clothes, or hold shoes while putting them on. These tasks require different degrees of movement and can improve hand dexterity. Household chores. Perform small tasks such as folding clothes, sweeping, or making the bed. Involving the affected hand in these daily activities not only promotes functionality but also increases confidence in using the hand. Writing and manual work. Practice holding pens, painting, or doing crafts. These activities require fine and precise movements, which are great for improving hand motor skills. Functional exercises. Ask your physiotherapist for specific exercises that you can incorporate into your daily activities. This may include repetitive movements that stimulate hand coordination and strength. Remember, consistency is key. The more you use the affected hand in different contexts, the more opportunities you give your brain to learn and adapt. It's normal to feel frustrated at first, but with patience and practice, you will notice significant improvements in hand functionality. And above all, stay motivated. Every small progress is an important step in your recovery journey. Continue to integrate the affected hand into your daily activities and watch how your independence and quality of life improve over time. By following these tips, you can significantly improve the function of your hand after a stroke. Additionally, I would like to reinforce the invitation to access my exclusive content in the link of the first pinned comment. There, you will have access to valuable information and practical tips to improve your cardiovascular health, contributing to the prevention of uncomfortable symptoms and promoting your vascular health. Don't miss out on this valuable resource, which can make all the difference in your quality of life and overall well-being. Comment if you have ever had a stroke, or if you know someone who has. Like this video so that YouTube recommends it to more people who need it, and subscribe to the channel to continue receiving our videos. Thank you very much and see you soon.